Hello everyone, my name is Tejaswi Worlikar and I'm from the University of Michigan Histotripsy Laboratory. I'm going to talk about my research work titled Histotripsy Inhibits the Development of Intrahepatic Metastases in a Rodent Liver Tumor Model. Liver cancer is one of the top 10 causes of cancer-related deaths worldwide. Although multiple treatment options exist, in many patients, the entirety of the tumor cannot be targeted due to many factors such as the size, location, or the disease stage, which results in dismal prognosis and poor survival outcomes. So histotripsy is the first non-invasive, non-ionizing, and non-thermal ablation technology which is guided by real-time imaging. Using microsecond-length ultrasound pulses, histotripsy mechanically destroys the tissue through acoustic cavitation, which renders the target into an acellular debris. So recently, there has been increasing preclinical evidence to suggest that histotripsy results in safe and effective tumor burden reduction and also may be able to stimulate potent abscopal effects. In an orthotopic rat liver model, we observed that both complete and partial ablation of the tumor resulted in complete regression of both the targeted and the untargeted tumor regions. In another study with the melanoma tail vein metastases model, we observed that histotripsy ablation of the subcutaneous primary tumor resulted in the inhibition of the development of pulmonary metastases. However, despite all of this emerging preclinical evidence, there's still not enough understanding regarding the effects of histotripsy on the risk of recurrence and metastasis following tumor debulking, especially because histotripsy is a mechanical ablation modality. We are disrupting the tumor, and it is possible that intact tumor cells may detach from the primary tumor and disseminate into the circulatory or the lymphatic system. Our understanding of the immunological response to histotripsy is also very limited, especially in cases of partial histotripsy ablation, where the untargeted tumor volume remains undamaged, but eventually also regress. So the goal of this study is to evaluate the impact of partial histotripsy ablation on immune infiltration, survival outcomes, and metastasis development in an orthotopic immunocompetent HCC rat model. So tumors were generated by inoculating MCAR777 cells into the rat liver, and 24 hours prior to the tumor inoculation, these rats were administered cyclophosphamide for immune suppression. In this study, we have early cohorts where animals were euthanized on day 2 and day 7 post-histotripsy. And we have the survival cohort where the tumors were followed up to 12 weeks or until the tumor reached the endpoint criteria, which was 2.5 centimeters in the largest dimension. And this table shows the distribution of animals. Only partial histotripsy was used in the study, which means 50 to 75% tumor volume was targeted. And there was also a small cohort of animals where we used scant histotripsy, where less than 25% tumor volume was targeted for ablation. So our treatment setup consisted of this 8-element 1 megahertz therapy transducer, which delivers 1 to 2 cycle pulses at an estimated peak negative pressure of 30 megapascals and 100 Hz PRF. So as you can see in this video here, we have the cavitation cloud, which is generated in the tumor region within the rat liver. As you can see, histotripsy treated animals had significantly improved survival outcomes as compared to the controls. More than 80% of treated animals showed complete regression with no evidence of metastases, whereas 100% of control animals developed intrahepatic tumor metastases and had local tumor progression as well. So these are representative T2 weighted MR images showing the rat livers. As you can see in the control case, the tumor continues to grow. In the histotripsy case, you can see the yellow arrow, which is showing the ablated zone, which is appearing hyperechoic 8 hours post-treatment, and the untargeted tumor region, which still maintains the appearance similar to the untreated tumor. Within 3 weeks post-treatment, the tumor has completely regressed. There were also 2 out of 11 cases where the tumor that was treated continued to progress. As you can see in these H&E images, the control tumor seems to have aggressively progressed and pretty much colonized the entire liver lobe. You can see evidence of intrahepatic metastases. In contrast, the histotripsy-treated tumor at week 12 shows no evidence of any viable tumor tissue. And then there's only like less than millimeter dimension scar tissue, which is left at the site of the original tumor. In the histotripsy-treated tumors, the two animals were, even after treatment, you can see that there's tumor progression. So these are images showing the early response of histotripsy. So as you can see, the control tumor on day 2, you're able to see some nodular extensions emerging from the primary tumor nodule. Histotripsy post-treatment day 2 tumor, you see this ablation zone in the center, surrounded by the tumor region, which was left untargeted. Within the ablation zone, there's a lot of blood products that are visible. The control tumor on day 7, you're able to start seeing some nodular extensions along the periphery. Again, signs of tumor invasion. The histotripsy day 7 slide, you're able to see the ablation zone. It's starting to get resorbed, and you're starting to see the formation of the scar tissue. And there's really no evidence of any viable tumor cells at this time point. In contrast, if you look at the scant histotripsy, where we treated less than 25% tumor volume, we're able to see that the ablation zone is still showing blood products similar to the histotripsy day 2, and is not quite as resorbed as compared to histotripsy day 7. And the tumor surrounding the ablation zone has continued to grow, which is clearly suggesting that 25% tumor volume ablation did not result in a good outcome, and you probably need a minimum percentage of tumor volume that should be targeted to achieve meaningful tumor response. Next, we looked at the immune infiltration. And again, we can see increased immune infiltration of CD11B positive cells, CD8 positive cells, and NK cells in the histotripsy-treated slides as compared to the control slides, which indicates that there's an increased immune infiltration, which could have promoted complete tumor regression, even though we targeted only a partial tumor volume. Again, as you can see in the scanned histotripsy cohort, we don't really see a lot of immune infiltration as compared to the partial histotripsy cohort, which again suggests that just treating 25% tumor volume may not be enough to stimulate a meaningful immune response to promote tumor regression. To look at the impact on metastases, we decided to look at the epithelial to mesenchymal transition markers, because that is one of the first steps in the metastases cascade. There is an upregulation of vimentin at the liver and the tumor periphery on control day 7. We also see a slight upregulation of vimentin on the histotripsy-treated tumor periphery between the ablation zone and the liver, and within the ablation zone on histotripsy day 7. To understand what this means, I'm just going to briefly go over the role of vimentin. So the expression of vimentin is linked both to metastases, tumor invasion, the EMT, as well as tissue healing, which is proliferation and remodeling of tissue. So it is our hypothesis that the expression of vimentin in control tumors, at the periphery of the control tumors, it could be linked to EMT, because we see that these control tumors eventually develop intrahepatic metastases and show signs of invasion on the histology images as well. However, we don't see any signs of tumor cells on the histology for the day 7 histotripsy-treated tumor. However, there's a lot of vimentin within the ablation zone. So this could potentially be linked to the tissue healing that's occurring within the ablation zones. However, this needs to be further investigated before we can make a conclusive statement regarding this. We also conducted a small pilot study to look at the abscopal effects. So tumors this time were generated in 2 liver lobes, and only one of the lesions was treated with histotripsy. This is the treated nodule, and this is the untreated nodule. And we observed a very interesting phenomenon in which both of these tumors were completely regressed within a month, with no evidence of recurrence or metastases. To summarize the key takeaways, we observed that survival outcomes in the histotripsy group were significantly improved compared to the control group. More than 80% of the histotripsy animals demonstrated tumor regression with no metastases, as compared to 100% of control animals which developed intrahepatic metastases. Histotripsy-treated tumors also demonstrated increased infiltration, which we hypothesized could have led to the complete regression, even though we treated only partial tumor. However, we also saw that if you treat a very small tumor volume, which is like less than 25% tumor volume, there isn't any meaningful immune effect or treatment effect, and the tumor still continues to progress. So there is a minimum threshold of tumor volume that needs to be ablated to see a meaningful treatment response. Finally, we saw women in upregulation in control tumors, and we hypothesized that it could be linked to EMT in tumor invasion, which is the first step of metastases, and the women that we saw in the histotripsy ablation zone could just be linked to scar tissue formation. And finally, we saw in the pilot study that the histotripsy ablation of a single tumor lesion may cause abscopal effect in a non-targeted region and causing it to regress along with the treated tumor lesion. I'd like to take any questions now. Thank you for your time.